What is fine needle aspiration for TB diagnosis? Imagine a tiny needle helping doctors solve a big health mystery. Fine needle aspiration is a simple, minimally invasive way to collect tissue or fluid from swollen lymph nodes or other suspected sites of tuberculosis infection. It's especially useful when tuberculosis affects the lymph nodes, a condition called tuberculous lymphadenitis. The process involves cleaning the skin over the affected area, then inserting a very thin, hollow needle, usually about 23 gauge, attached to a syringe into the lymph node. The doctor gently moves the needle back and forth to gather cells or fluid. Before pulling the needle out, they releases the suction to prevent blood contamination. The collected sample is then prepared for various tests in the lab. This method is valuable because it provides material for multiple diagnostic tests. Under the microscope, the lab can look for acid-fast bacilli, which are the bacteria that cause tuberculosis. They can also perform molecular tests like the Xpert MTB-RIF assay, which detects tuberculosis DNA and checks if the bacteria are resistant to rifampicin, an important TB drug. Additionally, antigen detection tests can identify specific proteins from the bacteria, such as MPT60, to confirm infection. One of the biggest advantages of fine needle aspiration is that it is quick, safe, and less painful than surgical biopsies. It can be done in outpatient clinics with minimal equipment, making it especially helpful in low-resource settings. The procedure usually takes only a few minutes, and patients can often go home right after. However, there are some limitations. Sometimes the sample contains very few bacteria, which can make detection harder. That's why molecular tests like Xpert MTB-RIF are often used. They're more sensitive and faster than traditional smear microscopy or culture. Culture tests, which grow bacteria over weeks, are more definitive but take longer. Using a combination of tests improves the chances of an accurate diagnosis. In summary, fine needle aspiration is a crucial tool in diagnosing extrapulmonary tuberculosis, especially in lymph nodes. It allows doctors to quickly and safely obtain samples that can be tested with advanced methods to confirm TB infection. If you or someone you know is being evaluated for tuberculosis, discussing diagnostic options with a healthcare professional is always the best step. Remember, accurate diagnosis is key to effective treatment and recovery.